Hi, everybody. I'm Congressman Raja Krishnamoorthi of the 8th District of Illinois. Thank you so much for allowing me to address this very important suicide prevention conference. I want to say a special thank you to the organizers of today's event, but also the participants. Thank you for taking precious time out of your busy schedules to address an incredibly timely and important topic right now. And that is, how do we prevent our friends and neighbors and loved ones from contemplating and committing suicide? This pandemic has been excruciatingly difficult for so many people. And in this time of isolation, and in this time of treating so many who have been ill and so many who've passed because of COVID, people have understandably developed mental health issues in addition to the physical healthcare issues that we all know about. And so now we not only have to talk about it, but we also have to address the very real issue of suicides. Unfortunately, they have gone up during this pandemic. And one issue that I would like to address briefly is one that hits very close to home for me. And that is the issue of the mental health of frontline workers and frontline healthcare workers specifically. My wife is an anesthesiologist at Glen Oaks Hospital, and so she's been treating COVID patients basically for the last 10 months, including intubating many of them in the ICU. And one of the things that I've taken away talking to her is just the toll that it's taken on the nurses, the physicians, the other healthcare workers in the hospital, and the staff who have to deal with this very present issue of COVID day in and day out. And so I have requested the Congress to take up my legislation, along with Brian Katko, a Republican from New York, to basically provide providers with greater resources to establish and expand mental health programs for frontline healthcare workers. I believe that it has a good chance of passing in this Congress and getting signed into law by President Biden. But I need your help, and I hope that you'll band together to stand with me as we pursue this legislation. In the meantime, thank you so much for your attention to the issue of suicide prevention and the prevention of mental health issues during this very, very difficult time for our country. Thank you so much, and please be safe.